Hello, this is Dr. Gay from First Lake MRI, and this is a 17-year-old female who injured her shoulder playing volleyball, has shoulder pain in the region of the AC joint. This is the distal clavicle here coming across. This is the acromion, and this is the AC joint, and we see here that things look pretty good. I don't see any significant widening. There's no offset, so it doesn't look like the ligaments are completely torn, because when they're ruptured or torn, sometimes the clavicle will drift upwards. Don't really see a fracture, so this all checks out good. Their shoulder joint is down here. This is looking good. So her symptoms are unexplained, and so they did an MRI just to see, is there something else going on? And so this is the MRI. So the MRI has multiple views. Rather than an X-ray that just has one view, the MRI will have a view where the marrow looks bright like this, another view where the marrow looks dark like this, and we have different angles like this, different orientations. But on this view here, we see that the humeral head looks great. The AC joint looks a little funny here. We see this dark band over the top of the AC joint, and this is some inflammation or thickening or injury up here. And we're going to look at another view, but this is right where she's hurting, so this corresponds to the site of clinical concern. And this is a view that's very sensitive to fluid. So on this view, we see the rotator cuff going over the top and attaching over here. And that looks perfect, so there's no rotator cuff tear causing the problems. Her labrum looked good, her biceps looked good, her whole joint here looks good. But up top here, we see the problem. Anything abnormal on this will be bright, and in this we see that she has lots of brightness up here. This is the distal clavicle, and while on X-ray it looked normal, here it looks terribly abnormal. She has a stress fracture of her distal clavicle, and the ligaments that hold on look like they're maybe partially stripped. There's a ligament that goes over the top and attaches to the bone from the AC joint, and it looks like that is partially stripped and uplifted from the clavicular periosteum, the bone there. This is a different orientation. We see the humeral head, and over the top we're going to see the acromion process here, and the clavicle is right here. And we see that lipo-bright signal, meaning that the clavicle is injured. Again, there's no displaced fracture, just a stress fracture, non-displaced. And there's a little black line here. This is part of the ligament attaching to the periosteum that's uplifted, a little bit of edema undermining that. So no AC widening. So this is just a grade 1 AC ligament injury, and just really a stress fracture or a really high-grade bone contusion of the distal clavicle causing her symptoms, and this should go on to heal just fine. But now they know that that she's not faking it, definitely has a significant injury here, and she definitely has to dial back for a while till this heals. Thank you very much.